Hello, I am Dr. Srikanth V. I am a practicing plastic and cosmetic surgeon. I practice at Clinique Belle and at Manipal Hospital. Lymphedema for a long time was not thought to be non-treatable. There was not much progress being made. A lot of the surgical options had huge complications, and therefore the treatment was not successful, making both the patient and the treating physicians unhappy. However, today we have plenty of happy news in the field of lymphedema. There are very many techniques which have exploded, right from trying to diagnose the lymphedema, trying to get into the details of the kind of damage the tissues have undergone, to the surgical options. One of the important and new exciting things that we have today is something known as ICG lymphography, wherein we inject a dye called indocyanine, use an infrared camera. This indocyanine glows in infrared light. So we are able to track live the flow of the lymphatics. We inject it into the web spaces and into the wrist, or on the leg, into the web spaces and near the ankle. And when we run the camera, we are able to see the fluid go up. We are able to see the kind of block. There are different stages. We see linear channel, we see stardust pattern, we see splash pattern, and we see diffuse pattern. Each of these indicating lymphedema, and each of us telling us what kind of treatment we should do. There is something known as technetium-99 scan, which is a radioactive dye is given, and using a gamma camera, we map out the flow of the lymphatics, which tells us where all the block is there. The advantage of this is it can tell you, with one single investigation, it can tell you the entire lymphatic system of the body. We are able to trace it out and find out where all the blocks is and where are the normal lymphatics are. MRI scans, of course, used to gauge the size and depth, and we do something called as volumetry, which helps us to compare the lymph, both the legs, if there is unequal lymphedema, to whether there is a difference, or with that of a normalized person, which tells us what the progress of the treatment is. But supposing somebody opts for a medical treatment, is there improvement 6 months, 1 year, 2 years, 3 years down the line? Volumetry helps us to decide whether this treatment is effective. Similarly, once surgery is done, volumetry is done at 1 month, 3 months, 6 months, 9 months, 12 months. So this tells us that yes, the lymphedema is reducing gradually. It gives an objective method for us to know whether the treatment is successful, the treatment is not successful, whether you will benefit with another surgery or not.